What is the difference between acute and chronic bacterial prostatitis? Imagine suddenly feeling a sharp, intense pain in your pelvic area along with a fever and chills. That's often how acute bacterial prostatitis begins. It is a sudden, severe infection of the prostate gland caused by bacteria, most commonly bacteria like Escherichia coli. This condition develops quickly, sometimes within hours or days, and usually causes noticeable symptoms. People often experience difficulty urinating, a burning sensation during urination, and pelvic pain that can be quite intense. The prostate itself becomes tender, swollen, and painful when examined. Because of the systemic signs like fever and chills, it's clear that the infection has spread beyond just the prostate. If not treated promptly with antibiotics, acute prostatitis can lead to serious complications such as abscess formation or even sepsis, which is a life-threatening response to infection. On the other hand, chronic bacterial prostatitis is more like a slow-burning issue. It develops over weeks or even months and is characterized by recurrent or persistent symptoms. Unlike the sudden onset of acute prostatitis, the symptoms tend to be milder but ongoing. Men with chronic bacterial prostatitis might experience recurrent pelvic discomfort, mild urinary problems, or intermittent flare-ups of pain. Interestingly, systemic symptoms like fever are usually absent or very mild in chronic cases. Diagnosing this form can be trickier because bacteria may not always be present in urine tests, but cultures of urine or prostatic fluid often reveal the infection. Treatment involves a longer course of antibiotics, sometimes lasting several weeks, and because bacteria can hide in the prostate tissue, it can be more difficult to completely eliminate the infection. Recurrence is also common, making management a bit more complex. The key differences between these two forms of bacterial prostatitis are quite clear. Acute prostatitis comes on suddenly with severe symptoms and often requires urgent treatment to prevent serious complications. Chronic prostatitis, however, develops gradually, with less intense but persistent symptoms that can come and go over time. Systemic illness like fever is typical of acute prostatitis but usually absent in chronic cases. On physical examination, the prostate is tender and swollen in acute prostatitis, whereas in chronic prostatitis, tenderness may be less obvious. Both involve bacterial infection, but in chronic prostatitis, bacteria may be intermittently present and harder to detect. Treatment for acute prostatitis is usually short-term antibiotics, while chronic prostatitis needs a longer, more sustained approach, and sometimes, managing it involves addressing recurrent infections. It's important to remember that prostatitis, whether acute or chronic, is an inflammatory condition that is different from prostate cancer. While inflammation has been studied for its potential role in prostate health, prostatitis itself does not cause prostate cancer. Proper diagnosis and treatment are essential to relieving symptoms and prevent complications. If you suspect you have prostatitis, consulting a healthcare professional is always the best step. They can perform the necessary tests, confirm the diagnosis, and recommend the appropriate treatment plan. Understanding these differences helps in managing symptoms effectively and ensuring overall prostate health.